Hello, everybody. I have not done this on YouTube before, so just figuring out all the pieces. And we have a chat here. So I see that we have a couple of people online already watching, and you're welcome to pipe in here and just tell me what you. Oh, hi, Beth. So good to know that you're here. Thank you for showing up. So as we go, if you have any questions, please be sure and put them in the chat, and I'll do my best to watch the chat as we're talking. We're going to be doing a whole homeopathic series. I don't know if you saw that, but this is the first of 4 classes, and we are going to be doing several classes. We're actually going to be doing classes every Tuesday night for a while. Every other week they'll be online, and then the opposite weeks they will be in the store. So watch that schedule and pipe in for the ones that you're interested in. So first, just a couple questions I thought I would ask, and maybe you can pipe in here and tell me if you know anybody who's dealing with anxiety or depression, either I guess just start there. You know, somebody that's dealing with anxiety or depression, and I think we probably all do, so that's probably an easy answer. But if you think about it, do you know, are there other things that go with that anxiety and depression? Yes, see, there are a lot of us dealing with anxiety or depression, and that's the reason I thought it would be a good idea to do this class. So I'm just going to say, let's kind of just jump in here, say that I have to give a disclaimer and remind people that this is not medical advice. I'm not a doctor, I'm not a pharmacist, I am a master herbalist. My name is Melanie Skelton, and I just love helping people find answers. That's really, I consider myself an educator more than anything. And so just remember that as we discuss that if you have questions about your health, then you definitely should take them to your doctor, and that's always important. So, all right, so let's talk about reasons why we feel anxiety or depression. And there are lots of reasons, of course, and sometimes getting to the answers is the challenging part, right? But some of the reasons that, if you have any reasons why you feel like you might be experiencing those, or you know people that might be experiencing those, go ahead and put those in the chat if you'd like to. Some of the ones that I think, one of the ones I think is a big deal right now is stress. I feel like stress is causing a lot of problems for people, especially the last few years. I think we've been through a lot, right? And stress can come from situations like what we've been coping with. It can come from illnesses, accidents, so many things, family, work, the list kind of goes on. And it can be something that happens suddenly, like there's a change in your life, or it can be something that builds up because we push hard and work hard. And then, and I guess I have 2 specific examples of that in my life. And Beth, you're probably familiar with both of them. I had an accident years ago, and that was a real sudden thing for me. And that did cause some stress and anxiety in my life. Whereas the last few years, just because, we started a business and we've been working hard, that's been more of a build-up situation. So other reasons why we might, that can at least affect anxiety or depression, I think, are things like lack of sleep. When we are not sleeping well, that definitely wears us down. Sometimes hormones can play into it, or other health issues, trauma, which kind of can come, be connected to that stress. Grief. I think grief can be a big one, that sometimes we have grief, we're dealing with grief, we don't realize that it or maybe we do realize that it can affect the other, the mental, emotional things that we're dealing with. Sometimes it can be side effects from medications, and so we want to be really aware of that, and make sure that we're paying attention to, if there's a medication that might have that kind of side effect, like let's figure it out and work with your doctor to get that figured out. Some people just have a personality that, we don't deal with stress as well as others. And so, we have to take that into mind for ourselves. We have to know ourselves and know our limits and kind of set those boundaries for ourselves. So I believe also that when we aren't getting the right nutrients in our body, that really can be another thing that affects us. And even, if we have the presence of disease or pain that we're dealing with, I mean, you think about when you hurt, it's pretty easy to get feeling anxious about that. Or else there are situations where maybe you've got a mom with a new baby, and we know that's kind of related back to the hormones that I mentioned, but that can be a real situation where she can be dealing with depression. So, all right, so I want to get in and talk about some specific homeopathic remedies. And again, just reminding you that I'm not a doctor, and we're just educating here. But there are some interesting things about the different remedies that as we dig in, you'll kind of understand how you can pin down a little bit really specific things. Sometimes it's fear of a certain thing, or it's surprising what can set one remedy apart from another. So, so first of all, though, real quick, let's talk about what homeopathics are. Homeopathics are a very safe remedy that can be used for a lot of things, physical and emotional, really. They come in liquids, they can come in little dissolvable tablets, and I always think of them more as an energetic medicine a little bit. Like I think of herbs as being nutrients for your body, and then homeopathics being more like the energy that the energetic part of it. And so they work well together because of that. And next week, our class is actually going to also be kind of on the same topic, but it will be in the store. And we're going to address kind of the other end of it, where we talk about herbs a little bit more, and essential oils, and gut health, and all of those things. So something to be aware of. So let's jump into our first little remedy here. Well, actually, no, I'm going to tell you something else first. So one of the things that a while back, I got this book, and I don't know if it's forwards or backwards on my video screen, but this is the Homeopathic Medical Repertory, okay? And it's written by Robin Murphy. He's a well-known teacher of homeopathy, and you can see how thick it is. And this particular one, I can go into, and you can see my little tabs here. I went in and I looked up anxiety, and I kind of want you to see this, because I'll pull this off so you don't have to see my tab. But in anxiety, there are multiple pages of remedies and information about anxiety. So, that's good. This was forward. Thank you, Beth. So there are pages of information about anxiety. You can it goes on and on and on. And as you look at these different remedies, it's kind of starts specifying, like anxiety at midnight, anxiety in the morning with mucus. You've got perspiration, so maybe somebody is perspiring, hysterical anxiety, imaginary anxiety, and inactivity, joyful anxiety. I'm not sure what that is, but it seems like when you're having anxiety, well, I don't know. I guess you could be having a happy moment and and anxious, fear with anxiety. And so there are a lot of different ways to look at it. And then the same with depression. There are pages of things about depression. Maybe somebody is dealing with alternating depression or after breakfast depression. You've got children, childbirth, and so you can see there are a variety of different things that different ways you can look at it. And I think that's because there are so many reasons why we feel stress or anxiety in our lives, or other things, all of those other emotions. We're complicated human beings, and we don't just there's not just one reason why we deal with those things. So and then I use that book, and then I bring it over to this book, and this gives me real specific information about each remedy. And so I've gone into this book and I pulled out some interesting information that I think, and that's where I've gotten everything that we're going through in this next little bit. So let's talk about some remedies. The first one I want to talk about is phosphorus. Okay, so phosphorus is one that might apply to somebody who's oversensitive to external impressions, noises, odors, and lights. Have you ever met anybody like that? They might be excitable or impressionable, or have a great tendency to be startled from noises, sympathetic to others. So you can see, like, this is a real maybe sensitive individual. Maybe anxiety during thunderstorms. All right, which then brings up an interesting point. A lot of people have pets who have anxiety from thunderstorms. Are homeopathics safe for pets? Absolutely. So this would be a great remedy for a pet who struggles with that noise of thunderstorms or fireworks or whatever else. So this one's interesting. Anxiety when lying on the left side. So that's pretty specific, isn't it? Frightens easily. They have a fear of dark, maybe a fear of thunderstorms, fear of something bad happening. They're spacey. They can't keep their mind on any subject. Brain feels tired, sadness during headaches, wants sympathy. So a lot of interesting mixes in that one remedy. And so when we look at a homeopathic remedy, the most helpful thing is kind of to look at that overall picture. And maybe it's a remedy that says, that it could help with anxiety, but what are the other pieces, and what is that picture, and how well does it fit with what you're trying to match up to? And so that's how I like to look at homeopathy. All right, another one is pulsatilla. And pulsatilla is kind of, I always think of moody, right? Changeable moods. So that's just moodiness. Emotional and tearful, craves affection and sympathy. Maybe they feel forsaken. They might have a history of abandonment or grief, or maybe not, but it could be somebody who weeps easily. And you think about even a child. You think of a child who cries a lot. Okay, give them pulsatilla. And maybe they are better being held and hugged. They might have a fear of abandonment or of being unlovable, and a fear of insanity. All right, so that's pulsatilla. And then also remember that these remedies come in different dosages. Okay, so when you look at, like, the potencies is the right word, actually. You've got like a 6X, a 6C, the 30C, and 200C are some of the main ones. And so like, think of a 6C or a 6X as something that you would use if you've got something that's kind of chronic and ongoing. Whereas a higher dose, like a 30C, would be maybe something more acute that has just come on more recently. And a 200C is, like, of course, really, really acute, and, almost, like emergency type of, anyway, we're really just trying to get at that. Okay. So next remedy I want to talk about is called Rus Tox, and it's spelled RHUS, Rus, and then Tox. Tox is actually is an abbreviation for a longer name. I don't remember right now. I didn't write it down, but it doesn't matter because we always call it Rus Tox. That's why I didn't write it down. So this one might be somebody who gets their mind and senses become cloudy. They might be forgetful and cannot remember the most recent events. They might have causeless weeping without knowing why, or have great apprehension at night and have struggle to remain in bed. They might have extreme restlessness with continued change of position. So you can see how that went with the previous one a little bit. If they're having a hard time remaining in bed, maybe they're just tossing around. Superstitious fears, irritability at night, better walking in open air. And they, so that's kind of a whole picture there. If you think about it, it's like maybe they're dealing with, some kind of emotional upset, but there are some really specific things that are going on where they are weepy and they're having a struggle at night, they're restless. And so those could be things to hone in on. The next remedy I want to talk about is called Aconitum napellus. And this one, some of the things about it are that this could be somebody who's dealing with a mental or emotional shocks. Okay, so they've got ailments that are coming from a fright that they've had. They might have nightmares, phobias, or panic attacks. Really dealing with fear, anxiety, and restlessness. They could be having fears specifically about the future, which is a little bit more of a specific things. Or, and I think this one is interesting, a fear of death. Okay, that's kind of specific. Forebodings and fears. They might feel terror-stricken. They might specifically have fears of going to the doctor or dentist. Okay, so those are real specific things that help us to hone in and separate this remedy from a different remedy and decide maybe which one is going to be the best the best one to try. So, all right, here is the next remedy is Ipecacuanha. I can never say it. It's like Ipecac. Okay, you've all heard of Ipecac, but this is the homeopathic version of that. And the one thing, this only has, I think, one thing on this one. Oh no, it has a few things, but mental depression. So, which it seems like depression is mental, but I think if you think about that for a minute, sometimes there can be more outer causes of what's affecting us, but this is but if you think of this as being definitely mental, then that can be different. They could be hard to please. Have you ever dealt with somebody who's depressed and hard to please? Or they could also specifically have anxiety during a fever. So that seems like that would be more of an acute situation right there. All right. One of my favorite homeopathics to talk about, I feel like I've used this in my life because it's applied, is Ignatia Amara. And this one is something that's really great to pull out if you're dealing with suppressed or deep grief. And it says in the book, with long drawn sighs. And that's really a telling thing about Ignatia Amara. If you're sighing, if somebody is sighing and they're dealing with emotional upset, but it's that sighing, that's definitely a thing. In fact, I will tell you a little bit of a story. When when COVID hit, we all struggled to just get through it, right? We were in this together, and I remember sitting in the office and Dale was across, and I realized at some point that we both kept sighing. Yeah, it was a little bit of grief for us. We were all kind of just trying to figure out what's next and how do we get through this. And so I went and grabbed some Ignatia and I said, here, we both need this. And so, and it helped. So very interesting. Other things about Ignatia that can be things to watch for would be an empty feeling in the pit of your stomach. other ailments from grief, emotional shocks and disappointments, disorders of the mind, particularly if accentuated by grief, sadness, hopelessness, hysterical, variableness, fantastic illusions. That's a lot of big words, isn't it? Much unhappiness, cannot sleep, worse from consolation. So I feel like that is kind of an interesting one. Full of suppressed grief. In fact, going back to the worst from consolation, thinking back, we were talking about pulsatilla a few minutes ago, where it's just like they were better being held when hugged. And then here, if you see, somebody is actually worse from being consoled, then that's a real defining point between those two remedies. So for Ignatia, they might be oversensitive and nervous, constantly frustrated, quarrelsome, have internal conflict, a rapid alternation of moods, highly emotional and moody, oversensitive to pain, joking and laughing, changing to sadness and tears. There are a lot on this one that really can be paid attention to. Spasms of insanity after grief or fright, obsessive compulsive disorder. That's a good one to pay attention to, I think. Fear of being hurt and disappointed. So, yeah. Okay, so let's go on now to another remedy, Spongia tosta. And this one might be somebody who's experiencing anxiety and difficulty breathing. So have you ever felt that, like you feel so anxious that it's like, I'm struggling to get a breath? This could be somebody who starts from sleep. So, just suddenly wakes up and like for no reason. Fear of death from suffocation. So we talked about in one of these other remedies, fear of death, but this is specifically fear of death from suffocation. Or anxiety about their heart, a fear of heart disease specifically. Okay, so if you have any questions at any point, you're welcome to put them in the chat, and I will do my best to answer them. But we're going to go through a few more remedies, and then we're going to talk about some flower remedies also, because there are so many options. And I feel like it's really all about just honing in on what are the specifics. And sometimes, like I said, they're very specific, like fear of death from suffocation. So next remedy is nux vomica. This might be a person who is very irritable. Have you ever met anybody who's very irritable? Sometimes I feel very irritable, but not tonight because I'm with all of you. So, well, sort of. Okay, so this might also be somebody who cannot bear noises, odors, or lights. So noises are going to bother them. They might be angry or impatient. They might be quarrelsome if they're disturbed specifically. Impatient when spoken to, gets angry and violent without any provocation. Concentration difficult while calculating. So like they're thinking hard and they're having a hard time concentrating. Workaholics. So you can kind of see a theme here of, somebody, they're a hard worker, they get into something, they don't want to be disturbed. Okay, so there's kind of an interesting theme there with nux vomica. They are ambitious and competitive, and they fear poverty. So those are all good clues on that one. All right, another remedy, Bryonia alba. This person, or a person who this remedy might be helpful for, could be exceedingly irritable. They want to be left alone. That was kind of like the last one, but a little bit different, right? The nux vomica. So Bryonia alba might be somebody who talks of business. Okay, actually, these are feeling a little bit connected to me. So let's see if we can find any specifics that separate them. Fearful of poverty, that one's the same. They worry about their health. And a child dislikes to be carried or touched. So that's kind of interesting. Those are similar, but a little bit different. And then, of course, we're just talking, as we talk through these remedies, we're really just talking about the emotional part of them tonight. These same remedies could have physical reasons to decide to use them. So, all right. Next one is calc sulf, and that is also an abbreviation. But that's how we tend to refer to these homeopathics a lot, so that's okay. So this might be somebody who is having confusion from mental exertion. They might have changeable moods, anxiety in the evening. They might be timid or irritable in the evening. I kind of feel like that anxiety and irritability in the evening, those are kind of going together. So, okay, another one of my favorites. This has been a favorite for a long time since I had little tiny kids. This is a common remedy for babies when they're teething, chamomilla. Maybe you've heard of that one. But specifically, chamomilla is really for whiny kids. Okay, not just kids, big kids too. Sometimes when I feel whiny, I pull out the chamomilla, right? So irritable, fussy, whiny, moaning, discontented, satisfied, demanding, children who want to be carried and held. I said that. Extremely sensitive to every type of pain. Have you ever maybe even either experienced or been around somebody who is like a little bit of a scratch, only it's intense, right? Sometimes I feel like that. Sensitive to music or noise. They're cross and uncivil. They're quarrelsome. Complain about anger okay, anyway. Complaints from anger is what it says, and vexation. Faint after an intense emotions or intense pain. Now this one's interesting. Fear of wind. Okay, so that is a real defining one. If you find a situation where somebody's afraid of the wind, like that's really specific. But also weeping during sleep. So if they're crying and they're sleeping, that could be a reason to pull that one out. Okay. Next one, I only have one on this, graphites. But if you have a situation where you feel dejected and discouraged, graphites could be the go-to remedy for that one. Gelsemium semp. Semp. It's longer than that, but we're going to say Gelsemium semp. And this one is a good one if you're feeling kind of dull. Let's see. Somebody just asked if fear of wind was chamomilla, and that's true. Yes, definitely. Okay. So graphites, dejected and discouraged. Oh no, I did that one. And then Gelsemium. Sorry. So Gelsemium was mental dullness, dizzy, drowsy. They might feel apathetic, especially regarding an illness. Mental exhaustion. So that can be a real thing if you have been working hard or dealing with things. Mental exhaustion can definitely play into that. A desire to be alone, wants to be quiet. Bad effects from fright, fear, or bad news. Fear of falling. Stage fright. I thought that one was interesting. And here again, we found this one says fear of doctors and dentists. Nervous dread of appearing in public, which kind of goes hand in hand with the stage fright, right? Lack of courage, anxiety, fear from traumatic shock. That's a good one to remember if you're, for that kind of the traumatic shock is can be a specific thing. And then, like we talked about trauma a little bit. Well, I guess that was grief with the Ignatia, but I feel like dealing with trauma, that Ignatia can play into that too. So let's see. Oh, also here are a couple more about the Gelsemium semp. Fear that unless on the move, the heart will cease beating. That's kind of an interesting specific one. Confusion, delirium with incoherent talk. Okay, we have one more of these, and then we're going to get into the Bach remedies a little bit. So the last one that we're going to talk about is Nat Sulf. And some of these that we've talked about are actually cell salts. This one is a cell salt, and there are, and so you can find them in like the homeopathic section, but also the specific cell salt section. So this one might be somebody who is having mental troubles arising from an injury to the head. That is kind of interesting. Mental troubles arising from injury to the head. Mental effects of falls or blows. So that feels connected to that first one. Confusion, better after stools. Okay, so depression and suicidal impulses. So that's a good one to know about. That's a sad thing that we're kind of seeing some trauma from in our society right now, suicide. So something to know about. All right, so let's talk a little bit now, because you've got like homeopathics, and I talked in another class a few months ago about kind of what homeopathics are and where they stemmed from. But they're, and we're not going to really get into that tonight, but just the idea that it is, they're remedies that have been taken from herbs, and then you create a tincture that we dilute and succuss. So dilute, of course, makes sense, and then succuss means that you're pounding that herb to kind of imprint the memory of the molecules on the water or whatever you're making the homeopathic out of. Well, there was another doctor, Dr. Bach, Nelson Bach, that discovered that, or identified that there are 38 states of mind, and there are flower remedies that he developed to go with those that are kind of interesting, and they work on balancing negative states of emotion. And so then he took those 38, from those 38 remedies, he took 5 and combined them into what's called rescue remedy. And that's a remedy that has been around for a while, and has, a lot of people really love that. That one has 5 of the Bach remedies in. We're going to talk about what those 5 are, because they're kind of interesting. So the first one is called Star of Bethlehem. And every time I look at that one, it just makes me happy, because it makes me think of, the Star of Bethlehem, right? And I guess it probably comes from a flower. I should go look that up. But I think of the star. So anyway, Star of Bethlehem is one that is to help you maintain control or neutralize the effects of stress. Okay, so remember, as we talk about these, that these are the 5 in the rescue remedy. So this one's going to help you maintain control or neutralize the effects of stress. Rock Rose is to help with panicked moments, to give you the courage that you need. Cherry Plum to maintain control when you are feeling out of control. Impatience to help with patience. And Clematis to help with clarity. And so he's kind of taken all of that and put it into that one remedy, which is very nice. Some of the other ones that jumped out at me in these Bach remedies as I was reading through them, because, we're talking kind of specifically about emotional health, but I've touched a lot on, like anxiety and depression, because I feel like that's such a thing that I talk to so many people who are dealing with that. And so some of the ones that jumped out at me were aspen. Aspen is the fear of unknown things. Does that ever cause you anxiety? Sometimes that causes me anxiety. I think that's fair, right? But if you're dealing with that fear of unknown things, that could be a good remedy to go read about and learn more about. Another one that was interesting is elm, which is a remedy that you might look to if you're overwhelmed by responsibility. Okay. Gentian could be one to look at if you're dealing with discouragement after a setback. Gorse could be is hopelessness and despair. And then honeysuckle if you're living in the past, I think sometimes we do get stuck in the past, and that can cause some of what we deal with, right? There's, this isn't one I marked, but this just jumped out at me. Chestnut bud, failure to learn from mistakes. Yeah, that's a fun one. And mimulus, fear of known things. So do you remember I said aspen was the fear of unknown things, and mimulus is the fear of known things. So that's a little bit specific to different fears that we could be dealing with. Mustard, if you feel just like a deep gloom for no reason at all, you can't identify it, then mustard would be one to learn about. Rock rose is going to be terror and fright. And rock water could be about self-denial, rigidity, self-repression. We talked about Star of Bethlehem. Another one that I think is worth noting is white chestnut. If you have repetitive thoughts, if you're struggling to sleep, and that's, one of the things, and you're just laying there with these repetitive thoughts, or maybe even during the day. I don't know about you, but when I deal with, like a couple weeks ago, I witnessed an accident, and it kind of brought back some of my trauma, and over those thoughts repeat in my head, and I thought, okay, that's one that I should pull out and maybe be using right now. Although I've been using Ignatia to kind of get through that, because that is always the one I generally pull out for that. But I might just have to add some white chestnut. Anyway, okay, so that gives you a little bit of a view of the Bach remedies, and those are a liquid, so they only come in liquid. Well, that's sort of true for the individual remedies. They do that. For the rescue remedy, it comes in a lot of different. They have little pastilles and all kinds of things that you can look at. So, well, if you have any other questions that are specific, I would love for you to put them in the chat. That's kind of the end of the material I specifically wanted to present. I hope that it's been informative and helpful. And again, if you weren't here at the beginning of the class, I want to let you know that we will be doing another class. We'll be doing a class every week for a while, every Tuesday night. Every other week they'll be online, and the opposite weeks they'll be in the store. For tonight, I was going to, for anybody who, let's see. Okay, actually, yeah, so be aware of that. Watch the web page. If you go to Melanie's help and you click on events, then it will take you to our page where we're keeping the information about all of the classes upcoming. So watch for those, and if you have any other questions, you're welcome to reach out to me. I would love to do my best to answer them. I don't know all of the answers, but I do have these two cool books that I can look them up and we can find the answer together, right? That's sometimes my best answer is let's find it together. So thanks for being here. Thanks for participating. I hope that you all have the rest of a great evening, and we will talk soon. Thank you.